Most times there are two scenarios. One, when you have a tooth that is broken and that is not salvageable, then we'll take the tooth out. And if the bone and the gum, the gingiva, is allowing me to get that implant in an optimal position, you get an implant right away. And depends on the location of the tooth, and most times in the anterior tooth in the front, I'll get you the temporary tooth right away so you can smile. But if it's in the posterior, preferably not to have a tooth on it right away for a healing period of time. Another situation will be, let's say you have lost your tooth for a long time ago and you have lost bone and gingiva, then I'll be building each parts of the oral condition so that we can actually have an optimal condition for a dental implant. Unless you have a major medical condition, most of the patients should be a good candidate. But one thing that I really take a look at after the medical clearance is done, making sure your medications that you're taking is not adversely reacting against the dental implant surgeries. I'll look at your bone and the gum is healthy first. And if that is cleared, then almost everybody should be a very good candidate for dental implants. Most optimal case where your bone and gum is healthy, the implant should take about 8 to 12 weeks to heal, and you'll get your crowns in there. But let's say your bone's not great and we have to build up the bone, depends on the size of the bone graft that we have to do. It probably takes about minimum 4 months, all the way to sometimes 6 to 9 months for the bone graft to heal. So I take every single case step-by-step approach so you will know what is really necessary. Most of the patients after the dental implant surgery, they're a little surprised that if it was a single implant surgery, they tell me, that's it. Yeah, that's it. And that's all we have to do. Is like, that's all we have to do. But be careful, you don't want to be chewing on that area. And then after a week, and then they went through maybe a day of discomfort and they're fine. But most surprisingly, when we actually do 4, 6 implants the same day, and then you'll be going home with brand new teeth, almost like a teeth in one day, their response is even better than single implants. Because it sounds like we went through almost an all-day surgery, but their response from the surgery is not as great as getting an extraction and implant done. Because all the implants are held together and they're acting as a one unit. So discomfort-wise, of course it varies depending on the patients too, but most of the patients going through either single or multiple implant patients, they're not really feeling as much discomfort as you expected.